recently John Kroger came out and forcefully proclaimed that the bill was constitutional, and that he in fact did file an amicus brief in favor of the bill that in potential lawsuits that it's facing now. Where do you disagree with Mr. Kroger? And how does he have this issue wrong or misinterpreted?
Well, as I said earlier, if part of his point is that it's clearly constitutional, I don't think it is clearly constitutional. I think it's a debatable question, as almost all legal questions are. But I think there's a very persuasive and more than plausible case for saying it's unconstitutional. The other thing I would disagree with Kroger about is the justification for him on behalf of the state of Oregon filing an amicus brief in this. What is it the stake that the state of Oregon has that justifies the expenditure of public resources in the filing of this amicus brief? But the one thing I do agree with Kroger about, and I should say he's a personal friend, and I hired him at Lewis and Clark. So,
Full disclosure.
Folks have me to blame for that, if that's how they feel. But and I think John is a very good lawyer, but he's also a very ambitious guy. When he filed or when he announced that he was going to file an amicus brief, he said that one reason was because this raised an issue of fundamental importance. And I certainly agree with him about that. I disagree with him about how it ought to come out, but I think it is an issue of fundamental importance because it goes to the question of what is the scope of federal power. And if federal power can do this, can mandate that you and I buy health insurance, I don't know what the federal government cannot do, and that means that they can intrude upon our lives in any way that Congress chooses, and that's both a threat to our individual freedom, but it's also a threat to the revival of the economy.
Okay, so it is an issue of fundamental importance to all Americans. We have rising healthcare costs. We have lower benefits in general over the years. Insurance companies are struggling to keep up with the demand. A lot of people blame the insurance companies for this. What is your take? What would you have done instead of this healthcare bill? Where would you have gone for healthcare reform?
Well, I think that we had a very real problem, and you've sort of summarized it. At the heart of it, it seems to me, is the rising costs of healthcare. And why do we have rising costs in healthcare? I believe that it's because we don't have a competitive market in most healthcare services. And the reason we don't have a competitive market is, I think, because of third-party insurance, by which employers provide the insurance, and employees, the consumers of healthcare, have no incentive to consume it wisely, the way they do most other things that they consume. So I think the bill should have worked on the third-party insurance model that dominates in the country. We should have more interstate competition, and we should have more transportability of healthcare policies, all of which would contribute to a more competitive market. And I think a more competitive market would reduce costs and increase quality. And the irony of it all is that Wyden, in 2007, when he introduced his Healthy Americans Act, he said that he would not vote for any bill that didn't introduce more competition. He understood the importance of competition. And yet, when this bill came up, he's one of 60 votes they need to pass it. He votes for it. It does nothing to fix costs. In fact, it increases costs, because if you're going to insure 30 million more people, somebody's got to pay for that. And that's either the taxpayer, which is you or me and me, or it's the insurance purchaser, which is you and me. Either way, the costs are going to go up. And under this bill, we now have more people who are going to make demands on Medicare and Medicaid, which means that doctors are going to have more patients seeking to be served under Medicare, and I haven't talked to a single doctor who says they make any money on Medicare patients. Indeed, they lose money on every Medicare patient they take, which means they got to run the cost up for people who are actually paying their own way. So it's just a loser all around, as far as I'm concerned. And I would have done something to try to go at the costs of
John McCain, when he was running for president, proposed the idea of health savings accounts, that where you don't lose the funds after a year and they're tax deductible. Do you think that's something that would be viable to drive down costs and increase
Yeah,
competition?
I think it's a great idea. My wife used to work for Forbes magazine before we were married, a long time ago. And Forbes magazine had, or Forbes company had, exactly that sort of a policy. So she got X dollars, I don't know what it was, for a year. And either she used it in getting health care or she didn't. And at the end of the year, if she didn't, there the money was, it was hers. So she had real incentives to go to the doctor when she needed to, but not go when she didn't need to.
Well, that's interesting because the current form of health savings accounts, you lose that fund. That fund, it goes to the government if you don't use it. So this must have been a change in.
Well, this was a Forbes company program.
So they didn't get any tax incentive.
No,
they just did it.
They just did it.
Oh, really?
They
Wow.
just did it.
That's pretty impressive.
Yeah, and you know, I think it demonstrates that if the consumer is going to be the beneficiary of that pile of money, they can either spend it on healthcare or they can not spend it on healthcare. They get it and they can spend it on cigarettes or whatever. And some people would argue that their worry about that kind of a system is that people will get less healthcare than they should because they're saving their money for cigarettes. That will be destructive of their health. But I just think we got to give American consumers a little more credit for knowing what's in their best interest and not have the government telling them what's in their